Assessment 2, Module 2, Systematic Reviews and Randomized Controlled Trials. Topic, Sampling Methods. Karen Koenig, student number 19972013. Comparison between treated group and controlled group. There is a treated group, which is a group of people that are given the new treatment to be experimented on. And then there is a control group. This is a control group is a group of people who are given the most widely or common treatment. Comparison groups continued. This trial is to identify which treatment is best. Treatments can come in different forms, such as drugs, surgical procedures, information gathered procedures, such as screening procedures, diagnostic procedures, and cognitive procedures. Patients or groups are allocated at random, hence the name randomized controlled trials. Random allocation is so to avoid bias. Sampling methods. There's two different types of sampling methods. When it comes to sampling methods, there are respectively two different methods of sampling to consider. That is, qualitative and quantitative methods of sampling. The sample method will depend on your subject of trial. An example would be if you were to sample a trial of what the population thinks towards farm fish versus wild fish, which is better and why. You would proceed with a quantitative sample method. Now, qualitative sampling, as mentioned in the journal Sampling for Qualitative Research, here the journal recognizes that qualitative sampling is becoming more recognized in the healthcare research industry. The difference between qualitative and quantitative comes from the way data is collected from these two different sampling methods. The aim of a qualitative sampling is to obtain a representation sample from the population, then analyze it back to the population of trial. Further, qualitative sampling is used to gather information on the psychosocial aspect of the population and market. Sampling methods continued. Continuing on qualitative sampling, it answers questions such as how and why, that is, the values, beliefs, and attitudes of the population. This would involve more questionnaire type sampling, and sample size may be relatively smaller than quantitative sampling methods. However, large enough for the study to have statistical power. Qualitative sampling. An example for a qualitative sampling method would be if a researcher wanted to trial a new drug for weight loss. The sampling method would contain a control group and a treated group. Here, the appropriate sampling method would be a randomized controlled trial, as the characteristics of such trial are pre-known to the researcher. The sampling methods would be targeting a population who are medically considered as overweight. The sample size would be anywhere between 300 to 3,000 people. Sample size is often determined by logistic and financial consideration, and a compromise always must be made between sample size and costs. The precision of a study can also be improved by ensuring that the groups are of appropriate relative size. Table 1. Here we have a table to compare qualitative and quantitative methods. So we look at the table on the left-hand side. A philosophical foundation aim for qualitative is deductive reductionist to test preset hypotheses. For quantitative is inductive and holistic. A study plan for qualitative is a stepwise predetermined. Quantitative, interactive and flexible. For a position of researcher, the qualitative aims to be detached and objective, whereas a quantitative is an integral part of the research process. Assessing quality of outcomes for qualitative is direct tests of validity and reliability using statistics. For quantitative is indirect quality assurance methods of trustworthiness. Measures of utility of results. For qualitative is a generalized one, so generalizability. For quantitative is transferability. Calculations. For sampling methods, once this information is taken into consideration, that is, the sampling methods, the next step is to consider in sample size is the calculation aspect. Calculations for sample size can be done with standard formulas such as means, medians, and mode. There are different methods of calculation for sampling methods. These include, but are not limited to, field trials, community trials, and cluster randomized trials. For field trials, in comparison to clinical trials, involve people who are healthy but presumed to be at risk. Here is where data collection takes place, in the field, usually among people who have not been hospitalized or institutionalized in the general population. Community trials. In this form of experiment, the treatment groups are communities rather than individuals or groups of individuals. This is particularly appropriate for diseases that are influenced by social conditions and for which prevention efforts target group behavior. There is cluster randomized controlled trial. Here, health intervention are allocated randomly to intact clusters or communities rather than to an individual population. Sampling methods and randomized controlled trials. What is the significance? Randomized controlled trials need to recruit or obtain a certain population depending on their experiment. This is where the relationship of randomized controlled trials and sampling methods is of significance. Sampling method is the next progression in the process of clinical intervention. Without a sampling method, randomized controlled trials would be non-existent. It is important to correctly use sampling methods, as sampling methods in science and for the healthcare industry is very important, as discussed. As one can understand, these methods are relied and trusted upon the population, hence why its validity and correctiveness is vital to the interpretation of the results for a diagnosis. Thank you for listening to my presentation. Karen Koenig.